PTK Coombs here from JTV News with another Hurricane Irma update. I am aware that the Minister of Health and Social Development, Minister Skelton, Hurricane Irma did quite a number on the territory, and nonetheless the medical systems and facilities. Before we get into the medical practitioners who've been on their feet for hours on end saving lives and providing the necessary medical services, let's start with how the medical infrastructure across the territory held up and has been holding up.
First, let me extend my condolences to those who have lost loved ones during Hurricane Irma. It was an extremely powerful hurricane. In all my life, in all my years here living in the Virgin Islands, I have never experienced anything such as Hurricane Irma, Category 5 hurricane. It has devastated the whole country. I think 99% of the housing stock in the country has been damaged in some form, whether it's minor or major, some total destruction. The health facilities and our doctors, and I must send out, give my appreciation for the work the doctors and the nurses and all the ancillary workers here at Peebles have done from since the inception of the storm to now. They have done a fantastic job in delivering first-class care to those who were injured and those who needed support from the health services. Our clinics in Anegada, Virgin Gorda, and Jos Van Dyks were recently being examined by the team that came in here from PAO to ensure that they're safe and of good structure in order to continue services at these facilities. They have done the assessment early today. I haven't seen the final report, but I think all in all, if you look at the major health facilities in East End, Virgin Gorda, Anegada, Virgin Gorda, Jos Van Dyks, they can still provide some level of services to individuals. The problem is here that there are a lot of people who need some place to rest their heads, and it is being done in the shelters. So most of the care, the medical care, is done at the shelters now. So it relieve the clinic, so to speak, of providing this service. But there is no doubt Hurricane Irma has done us some severe damage, and we will rebuild our infrastructure, we will rebuild our country. This new hospital that we have built have proven that it was a very important investment at the time when we did it. The helipads that are here that are bringing services in injured people to this facility, it says that the government was thinking long term. And I can only say that the volunteers out there who are pitching to help us rebuild this country, I think we can only be proud of them. You know, the streets are being cleared as we speak. The solid waste department and the public works and the water and sewage, they have all pitching and they're cleaning the streets. And we will rise again. So I am proud of what our people are doing. I know they're tired, and I know they need all the encouragement they can, and I can only be their cheerleader and tell them continue to do the good work they're doing.
The operations of the NEOC are also based here at the hospitals, and that is also a testament to the value of this structure.
Yes, what you're seeing here is the 911 center that we were in the Ministry of Health was developing for the country. That anything happen in the country comes through this 911 center. Now it is being used, it's not finished, it's being used as the NEOC headquarters, and they will occupy it for as long as there is a need for them to occupy it.
What kind of, I've noticed that relief aid has been coming in from the marine helicopters. What kind of aid are the international supporters providing for the medical services needed here?
What I must say, the Royal Marines, they have supplied medicine to the hospital. They have the St. Lucian government, I understand, have sent supplies, and it's been delivered to the sister islands. We give them priority because they might be. It's very difficult for us to get there when we want to. We don't have access to helicopters and so forth. And the aid that is being pledged to the country is more than sufficient for the needs of the country over a short period of time. What I must say is that the fuel supply, both diesel and gasoline, is more than sufficient to last us for 2 or 3 months. So all the lines that you see that are happening out there, get blocked roads and stuff, there's not really a need for that. I think one of the decisions that probably we need to make is to allow the gas stations to fill the cars and do what needs to be done so people can feel more comfortable that yes, we have been knocked down, yes, we have been damaged severely, but there is no need for some of the things that are happening. We have enough food supply in the country with both aid and private supermarkets, the K-Mac and the Rotom Wholesale and Barbies, and they have sufficient stock, and stocks are coming in to meet the needs of our citizens. There were people, there were kids in our society that need to be educated. There's no question that the damage that has been done to our educational infrastructure is severe. We need a few months, 3 to 6 months to bring it back. And I will encourage the parents of kids of school age, if they can take them out of the country to schools where they have families and so forth, they should do so. This is something that all of us have never experienced in our lives. But what I know is that we are resilient, and we will rebuild our country again better than what it is, with the help of our Caribbean neighbors and our neighbors around the globe.
Speaking of education, Prime Minister Alan Chastany of St. Lucia, when he arrived, spoke of one of the possibilities that will be explored is collaboration in education to get children continued education while in other neighboring countries, as has been done before in the OECD.
Yes, the Minister of Education is working up a plan. Minister Honorable Myron Walwyn, he's working up a plan and to make sure something like that happens. Yeah.
All right, I know it's preliminary and information is still coming into you, but what can you say about the cases that were treated during and have been treated post Irma in terms of immediate medical needs of residents?
Yes, there were 5 cases of that we needed to medevac people out of the country, and the last report that I got, that all arrangements, some were already done, and there are 1 or 2 that needs to be followed through. So those things have been done. We have medevac people out of here. We have an airport with limited operation because we want to recover our country. So we are basically using the airport for military purpose and humanitarian aid. I understand that sometime next week commercial flights will be resumed. We are allowing private charter flights in and out of the country. Well, not in the country, but out of the country. The less mouths we have to feed, the better for the Minister of Health. So it's a process, and I must give all my support to Charlene and the NEOC for the hard, long hours they're doing to make sure our country recovers.
You're a man with a massive portfolio. It's not just health, it's also the social side of things. So in regards to that, a lot of persons are sitting, well, not necessarily at home right now, but outside and in shelters wondering what the government is going to do for me. and when? What can you say at this point about responding to those needs?
One of the things that we have to start discussing, which is recovery side, is we need some temporary housing. We haven't done it yet because we still in the kind of immediate response mode. But we must be able to get housing, temporary housing for people. They must never be allowed to be here long term, but on a short term basis, because we don't want these things to stay here waiting for the next Irma to come and we'll be back the same place we are now. So that will be done. We're trying to get whatever social support that the children will need from the shock and from support that they will need in order to be strong. So there's a lot of stuff, and my permanent secretary, Dr. Potter, and Dr. Georges, they're all working to make sure that what comes out of this is not the difficult, the stuff like this could lead to diseases being spread and so forth and so on. So we're trying to make sure that those things are kept at bay.
Final words to the people of the BVI who are looking to the government for leadership, support, and strength.
I think they have it. They have that in this government. We were out of communication. The people want to hear from the elected representatives that there is hope. And now that ZBVI is up, and now that we are getting back JTV, we're getting back Lime, Digicel, Facebook, and all of these things. Now people can basically get messages that there's no need for looting, there's no need for hoarding. There's enough food, there is enough supply to feed us. There is no need. And those people who have, like the Commissioner of Police said earlier, those people who have performed acts of looting the various places, breaking them in if there are videotapes and so forth, that they will be prosecuted. I think that's exactly what needs to be done. There was no need for it. So that part of it, I am very surprised of what happened here, because it never happened before. We had about 5 hurricanes that passed through our country from 1990 to until now. I think 89, Hugo, Marilyn, George, and all of those hurricanes, and it never happened before.
Thank you very much for speaking with me, Minister Skelton.
You're welcome.
There you have it from Minister of Health and Social Development, Ronnie Skelton, speaking about what's being done on the health and social side of things here in the British Virgin Islands. Peter Gay Coombs for JTV News.